Now to the homelessness crisis America has been dealing with for years. The pandemic and record-breaking inflation only makes the problem worse. The National Alliance to End Homelessness says in January of 2020, there were more than 580,000 people across the U.S. experiencing homelessness. In Los Angeles alone, an estimated 40,000 people are living in tents and cars and sleeping outdoors. But happening today, new LA Mayor Karen Bass is launching a new program she's calling Inside Safe, aimed at moving people from tent encampments into hotels. And Susan Shelley is a columnist and editorial writer, for the Los Angeles Daily News. She's joining me right now. Thank you so much for being with us, Susan. So you've been covering this crisis for years now, and newly elected Mayor Bass declaring the state of emergency on homelessness on her first day. Is moving the homeless into hotels a realistic start to a long-term solution, or is this just a quick fix like it was during COVID?
Well, that's exactly right. This was a quick fix during COVID. The idea was to protect people's health by getting them off the streets and out of these encampments. It was a very secretive program, started in 2020. It was called Project Room Key. And then gradually it was turned into a permanent program called Project Home Key, in which the government bought hotels and then turned them into homeless housing. And there are a lot of problems with this because hotels are a revenue source for local governments. Homeless housing is an expense for local governments. These are very expensive per unit for services and for housing. And it has all been done in a big hurry, without a lot of oversight, without any public input on where these locations are or what the impact is on the community or whether the program is even effective. Many cities have found that people who are in the program leave the program and just walk away, and they lose track of them. Yeah. So the track record is not very good.
Yeah, I remember living in LA when Mayor Garcetti did something similar to this, wanting to build up apartments for the homeless. But a number of homeless don't want to reside inside a building. And there is a severe mental health and drug crisis. My mother's a social worker. LA voters are going to be deciding in a couple of years, less than a couple of years, 2024, whether hotels in LA County will be required to shelter homeless people in unbooked rooms every night. So what are you hearing from hotel owners, voters, homeless advocates? What are they saying?
Well, this is something that was put on the ballot by the union that represents hotel workers. And I think they did it because they want leverage to negotiate, or they want to create fines that then have to be mitigated with negotiated settlements. It's obviously not practical. It's not realistic. It would cause a tremendous impact on the hotel industry, just in terms of whether they could get insurance and what the staffing would have to be to provide services for that population in a working hotel simultaneous with its regular business. It's completely impractical. So I doubt if voters will approve it, but it was put on the ballot with signature collection, and California has the initiative process, and the voters will have the final say.
You know, President Biden announced a new plan on Monday called All In, aimed at finding housing for people without it and providing some resources to keep them housed. So what do you believe needs to be in the plan, not just for California, but for the entire U.S., for this to actually be a viable solution?
Well, the first thing we have to do is recognize that this housing first model, which is built into all the funding for federal, state, and local projects, is not working. Housing First says that you have to provide apartments for people without any requirement for sobriety or job training or anything that will help them solve the problems that put them on the street in the first place. Housing First is fine for people who are homeless due to poverty, but for people who are severely mentally ill, gravely disabled by mental illness, it's no solution. People have to be patients, not tenants, when they have gravely disabling mental illness. And this plan has no plan for funding large psychiatric hospitals so there are enough beds for the people who need them. There's no plan for large facilities for substance abuse disorder treatment. These are the serious problems that are putting people on the street, and enabling the addictions and failing to care for the mentally ill is not a policy.
Susan Shelley, thank you. You make so many good points, and I know it's very controversial. A lot of people think you've just got to put them in a house and then they can get the help they need. But a lot of times those simultaneous services are their only hope. Thank you again for all of your reporting on this topic.
Thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.